Okay, hello everyone. Thank you very much for sparing time to join us in this webinar. Again, I just want to be sure that everyone can hear us, but please, if you can't hear anything, feel free to type in and we'll see what to do. I have colleagues here tracking the charts. So I'd like to welcome you to this webinar and thank you very much for sparing time to join us. My name is Rose Oronje. I work at the African Institute for Development Policy, the Director for Science, Communications and Evidence Uptake. And I'm going to be leading this webinar together with my colleague, Kirsten from FHI360, who has played a very central and lead role in the development of this curriculum, and she will be taking us through some of the sessions during this curriculum. Just before I get into the content, I think I had requested those who are already online earlier to introduce themselves, but if you've just joined in, please just type in your name and what you do. We want to have a good sense of who we're engaging with online. And just to note that would like to request if you should feel free to post any questions on the chat as we go on. But just to note that while we'll respond to some clarifications questions as we go, we will keep the substantive questions for the discussion session towards the end of the webinar. But please do feel free to keep posting questions as we go. Also to note that the webinar will be recorded, and so the video will be available for future reference. And then towards the end, we'll have a very short poll just to get some feedback from you, but we'll flag that when we get to the end. So I'm going to just move on now into the substance of the webinar. The main purpose really is to share the evidence-informed policy-making curriculum that we have developed under the Strengthening Capacity to Use Research Evidence program, that is Secure Health. And we also want to share some useful experiences and lessons that we've drawn out of using this curriculum. And also importantly, we would like to learn from you as well. We know a number of people are doing these kinds of training around the world, and we'd like to also have a chance to learn from you on if there are any similar resources and some of the experiences that could help us keep improving the curriculum. So those are the three main reasons, and hopefully we will achieve them. So the agenda is, what I'm doing right now is the introduction and background. We'll then move to highlights of the curriculum, which will be covered by Kirsten. And then we'll come back to me to talk about some experiences using the curriculum in Kenya and Malawi. And then we'll get into questions and answer, and then wrap up. So just to give us some background on why this evidence-informed policymaking course, as you all know, people working in this area, there has been an increased focus on the value of evidence in development efforts over the last 20 years. And so out of this work, we have developed the Strengthening Capacity to Use Research Evidence in Health Policy program in Kenya and Malawi, which we've been calling Secure Health. And this is a DFID-funded program. It's one of the DFID BQR programs running from 2013 to 2016, so just 3 years. And we're now in the final parts of the program. And this program has really prioritized the demand side of evidence. So the people who use evidence, particularly within the bureaucracy, within governments. And so this program has been, the training program has been developed to address the capacity gaps or capacity needs among people, policymakers within the Ministry of Health and Parliaments in Kenya and Malawi. And just note that at the start of this work in 2013, we conducted a needs assessment in the two countries within the Ministries of Health and within Parliament to just get a sense of the status of skills, but also institutional capacity to support evidence use. And so this course that we are launching today is a response to the identified skills gaps that we gathered through that needs assessment. The course is just one of the interventions that we have implemented under the Secure Health program over the last 3 years. So coming back to the main purpose of this course, or what we are trying to achieve for this course, is really to strengthen the technical capacity of mid-level policymakers in the health sector in accessing, appraising, synthesizing, utilizing research evidence in decision making. Below here, I've just identified some of the key skills that we have been focusing on addressing. One of them is building the capacity to be able to define clear policy questions that could benefit from evidence, being able to identify leading sources of research evidence, what are the leading journals or databases, but also, more importantly, being able to establish and maintain relationships with the producers of evidence, the researchers, being able to conduct systematic and effective searches of evidence, critically appraising the evidence, because we know there are a lot of not very good evidences out there. So how do you go about appraising it? Adapting research findings from elsewhere to use in local context. It also sought to cover skills on review and synthesis of evidence on various documents to tackle policy issue, and then preparation of a policy brief to offer recommendations out of the synthesis of the evidence. So those are some of the key skills that this curriculum has been seeking to build. The target audience, largely for those who are benefiting from the training program, has been, as I said earlier, the mid-level policymakers, and these are basically technical staff charged with preparing policy memos or policy documents or preparing evidence briefs to advise senior officials. And so within Parliament, for instance, these have largely been policy analysts or researchers, as well as committee clerks who support the Health Committee. I have to note, though, that the curriculum has focused very much on the health sector, but within the two parliaments in Kenya and Malawi, the parliaments requested us to engage all their staff who support the different committees, because the principles of evidence use are really the same. And so beyond the staffs who support health committees, we trained more staff who support other committees. Again, the curriculum is really focused on low-income settings, so it might, it might not apply very much people in different settings, because we've implemented this for the African context in most cases. And then for the trainers who we hope will use, these are basically skilled, experienced trainers who have in-depth understanding of the policy-making process, but more importantly, the role of scientific evidence within this process. Just to mention a few things on how the curriculum has been developed. As I said earlier, we conducted a needs assessment at the start of the Secure Health program in the two countries. And out of that, we identified key gaps, particularly when it relates to skills for using evidence. And besides the capacity needs assessment, we also did a comprehensive review, just searching online for tools that are being used for capacity building for evidence use, but also a review of other literature, what literature is saying on capacity building for evidence use, the gaps, and what can be done. Out of this review, we defined a focus for the EIPM curriculum and developed the zero draft. This zero draft went through critical reviews and revision within the Secure Health Consortium. And I should have mentioned earlier that the Secure Health Consortium is led by AFIDEP, but we have other institutions who are implementing with us this program, and that is FHI360, who have had a big role in the development of the curriculum. Then we also have the College of Medicine at the University of Malawi. We also have the Consortium for National Health Research in Kenya. We've also had the East Central and Southern Africa Health Community, which is our regional partner for sharing lessons. And the UK Post, the Parliamentary Office for Science and Development in the UK, is a collaborator on the program, particularly for the Parliament component of the training. So these partners critically reviewed the curriculum and provided feedback. And then the revised curriculum was also shared with officials in the Ministries of Health and Parliament in Kenya and Malawi to get their feedback and their feel of whether it's really responding to the needs. And then we field tested the curriculum in Kenya. We didn't field test in Malawi, but we only did it in Kenya, again for costs associated with this activity, and revised it, following which we now use the curriculum to conduct actual trainings in Kenya and Malawi. And then following these trainings, which we conducted most of 2015, we have now drawn lessons from that, which we have used to review the curriculum and revise. And what we are presenting today is something that has benefited from all these processes. The curriculum was driven very much on enabling learning. And again, because we are targeting adult learners, we're very keen to build in components within the curriculum that enable effective learning. And so it has been greatly underpinned by adult learning principles, we have built in a pre-training engagement with reading materials, which we send to participants ahead of the training workshops, again, just to start introducing concepts. We've also engaged participants to identify policy issues that need evidence, so that they come to the training with a very clear policy issue for which we will work with them throughout the training period to define evidence and identify and synthesize evidence for that issue. We've also built in very strong monitoring and evaluation components, so pre and post tests, session evaluations, questions and exercises during sessions, but also practical application exercises, particularly the development of policy briefs, which a lot of the people we had interviewed earlier had said were really keen to know how to go about looking at different evidences and end up producing an effective policy brief with clear recommendations for tackling policy issues. In terms of the design of the curriculum, as I said, there's a pre-training engagement with participants where we shared pre-reading materials. There was a pre-training test and online, which used online the Survey Monkey to just take them through a number of things to see where their skills are. 4.5 days workshop to cover all modules, and Kirsten will be going a bit more into the different modules of the training curriculum, and then a post-training test, again, just to, using the same tool to see what difference the workshop has made. And then an important part of this curriculum has been a 1-year post-training support to participants in skills application, completion of their policy briefs, because at the training workshops, they say developing policy briefs. And so during the last 1 year, I've been supporting them to complete this, but also understand how they are applying skills, the gaps, and building some refresher training workshops around the gaps they keep identifying. I'll just highlight where this curriculum is. I think many of you probably already know, but this curriculum is already uploaded on the AFIDEP website, and this is the link. If you haven't accessed it yet, this is the link where you can access the curriculum. If you want to do that, as Kirsten gets more into the content of this curriculum, it might be good for you to be looking at what we have online. So I'll now hand over to Kirsten to quickly take us through the key highlights of this curriculum, and then I'll be coming back to just share some experiences and lessons out of the workshops we've been doing and the support we've been giving to people who have benefited from this training. So Kirsten, please take over. Thank you.
Okay, greetings everyone. I hope you can hear me. I'm Kirsten Kruger. I'm a technical advisor in research utilization at FHI360 in the US. And you've just heard from Rose about the what of this project and this curricula and a lot of the how. I'm going to be going into more detail on the what it is, what's included, content. But there's a question I saw, which I just want to address very quickly, from Vanessa about how we tested the curricula. So just quickly, we did pilot test it and ran the early documents by colleagues in the Ministry of Health and on the Secure Consortia, and with, yes, with capacity building experts at FHI and at AFIDEP. I think Rose may get into that more at the end when we do Q&A, but I just wanted to give a quick answer there on that one. So before I launch into the content of the curricula and our approach, I just want to say that this work very much fits in with what I do as a research utilization specialist at FHI, where our whole focus and motivation is to maximize the potential for getting findings used in programs and policies and government. So it was a very nice fit and a lovely project to work on. And again, just Rose has talked about this some, but to ground us all, the audience here, because I believe we probably share many of these beliefs about the why of this, being that we all know people really want to use the best and latest evidence, and everyone wants to work smarter and improve their skills. We know that evidence in decision making and policy is essential for development. So the capacity building work creates an enabling environment. And then by allowing more individuals and institutions to become self-sufficient in using research, finding it, sourcing it, appraising it, we create a bigger culture that values effective evidence-informed policymaking. So we know that training is rarely an answer in itself, and this training was embedded, as Rose mentioned, in a pre and post-workshop component. So that's just an important feature to know, and it is described and talked about in the curriculum materials, but there were all kinds of activities, including the pre-reading that Rose mentioned, but also a lot of engagement with selected staff in ministries of health and government to really try to identify the right individuals to participate in the capacity building program. And then we also ensured that those individuals had an active policy issue that they were working on. So they came into this program with a on-the-job need, and were able to use that throughout the pre-workshop, the actual training workshop, the learning event, and then in follow-up. So just noting that it's embedded in this, this best practice of ensuring that training is just not a one-off activity. Rose mentioned the adult learning. That's another important feature to highlight, is that we really structured a lot of the activities to allow learners to share and learn from each other. And that really came out, and we needed a lot of time, as I think we'll get into in some of our reflections, to allow that to happen. But we were really focused on making sure that this was an opportunity for participants to share their expertise and learn from each other. Another feature was a case study that we piloted and made available in the subsequent iterations of the curricula that allowed, it was a sort of common public health scenario, and it allowed learners to have a storyline to follow throughout the training and to practice some of the skills and knowledge that we were supporting them with, such as what is a policy question related to this scenario? What would be search terms you would use related to this scenario? What kind of conclusions can you draw from a body of evidence using this scenario? And let me go to the next here. As Rose mentioned, the curricula is now on the web, and it's available. Hopefully some of you can pull that up even now as we're going through the webinar and look at it. But here's a screenshot of what it looks like on the AFIDEP site. And then once you go into the facilitators guidelines, there's two giant components, the facilitator side and the participant side. And there's a lot of match between them, but clearly some that's just for the facilitators. So you see the 7 modules here, including an introduction and wrap up, the main content there in the middle. And again, some extra special stuff for the trainer. You can see here on the slide, there's activities and different materials for the trainer related to preparing for the event and then post-training. We offered a lot of guidance, and the curricula is really built to be pretty much off the shelf. I would say it's very detailed, and including the session plans, the supplies needed, the time, learning objectives, and really stepwise how to go about the activities, in the hopes that it really can be an off-the-shelf product for people. Some of the extra information we included were, how to adapt materials, extra guidance on evaluation, suggestions for productive training, we made an effort to, as everyone really should, but we made an effort to include gender sensitive facilitation techniques and also just activities and examples throughout the material, and included a section that we called From Trainer to Trainer, which was some of the advice and feedback we had from our pilot test trainers and then those in Kenya and Malawi who were doing the training. They offered up some suggestions and feedback. I'm having a hard time moving to my next slide here. Hang on one sec. Okay, so this first module, as you might imagine, with an introduction, provided just the overview and rationale for the learning event, and that included all the get to know you activities and the goal and objective, describing the larger capacity building program, the group guidelines, and we presented the results of the pretest in that early module, the introduction. The next one, you may notice here that there's a module 1 is actually 2 in the actual graphic. I'm going to try not to confuse us, and I'll just use the name instead. So this next module, the foundation of policymaking and evidence use, went over the terms and the role of evidence in policymaking. We talked about the value of evidence-informed policymaking, some of the barriers and facilitators of using evidence. We talked about the context and sources of information that influence policymaking. And there was a practical exercise here where participants actually drafted their own policy question using that issue they brought with them. So the next module, accessing evidence, is, as it sounds, it's really looking for the information, evidence, findings that you might need to help bolster a case or present the evidence for decision makers to use in their decisions. And we have some information there about engaging with researchers for evidence and the types of search engines and databases one might use, and really tried to identify high quality ones and those that are open access. We went over the steps in a search strategy and different kinds of tips for searching and a form to use when you're pulling information off the internet or from other libraries or databases. And then again, the learners had an opportunity to do some practical work and do those different tasks, searching and looking at the quality of their search engine for their policy question and developing their own search strategy. In the next module, the appraising evidence, we were looking at the characteristics of basic research designs and methods and the types of evidence generated from those different designs. And I'll just make a footnote here that this was an add-on. This was a request from, I believe, from Kenya in the early days of this project, who, when looking at one of the early outlines for the curriculum, said, you know, actually our folks really would like this. They'd like a primer on what research designs and methods are. So that was an add-on. But this section also talked about the characteristics and questions to use for appraising the strength of a research paper, an article, and also a body of evidence. So it was looking at both of those, the single study and the body of evidence. We had a little section also about critical thinking and applying that to evidence. Again, I think that was an add-on, a request that we had from some of our users. There was a practical activity in this section where participants were assessing the levels and measures of strength of evidence for the evidence they found in the previous section, the previous model. So looking to judge what it was that they had found worth keeping or not. Moving on, the next module is synthesizing evidence. And in this section, we're looking at the characteristics for assessing usability and the steps in synthesizing what it was and how you do it, and looking at what makes a policy recommendation actionable, how to turn findings and recommendations into actionable activities for decision makers. We looked at the key elements of a policy brief, and participants then spent a good amount of time drafting both a synthesis of the evidence they found, but also a beginning draft of their policy brief. And we had another fun piece that we added in, which was about the elevator pitch, the term that not everybody identified with, but got how to pitch in a very short amount of time what you might say to a decision maker or somebody who's asking for evidence on a particular topic, how to do that when you capture them in the elevator, the lift, outside, at lunch, that kind of thing. And that was a very practical exercise that folks enjoyed doing. The next module, applying evidence in policy making, we looked at the indicators of evidence use. And I will say that we also did this in the very beginning. We didn't wait till the end to get into that, but we looked at what it looks like, how can you know that you've used evidence? And then we talked about developing a communication strategy, and participants had an opportunity to do that. They developed a communication strategy with objectives and outcomes and audience, messages, channels, how to evaluate it for their policy issue. The last module is the wrap-up, and that included the way forward for what happens next. Participants did a learning contract at that time to help guide the last phase of the program, the follow-up component. So that contract included different things like what aspects of the learning event will you actively apply in your work, identifying specific content areas that they wanted additional on-the-job support or training, and then creating a schedule for themselves for completing their policy brief or the other. They could have chosen another evidence product, synthesis product, but most did a policy brief. So this ending piece is the kind of things that you would imagine. There's takeaways, checking back to see how we did on the expectations for the workshop. We got evaluations from our participants. They took the post-test at that time. And then in some trainings, participants actually did their elevator pitches for some dignitaries and other VIPs from the Ministries of Health who had come to that final session. So they had, again, a chance to practice. And you can see from the slide there that we got some positive feedback from the external evaluators who did interviews with participants and their leaders to find out, what kind of outcomes did we impact, and they noted both these individual and institutional outcomes and felt that this was a proven curricula to use again, to use more. I think that's it for me in terms of describing, yeah, that's it for me, so I'll turn it back over to you, Rose.
Thank you through the curriculum. I'll just highlight some useful experiences and lessons that we've drawn over time and which we believe that will be useful for some of you who might want to use this curriculum. Obviously, this may not be very comprehensive, but we've kind of tried to pick some of the key things that came out of this. And we're obviously very open to share more, particularly with people who are keen to use this curriculum in future, to engage a bit more in terms of sharing on how to make this more effective in different contexts. So I thought I would start with just highlighting that the curriculum has been evolving over time, and I think Kirsten did mention that a bit. Following the field test, the number of things we changed. We obviously introduced the research methods primer. So initially we didn't have a comprehensive, or rather some really good focus on research methods. We really focused on the use of evidence. But following the field test, I think it came out very clearly that the target audience needed to have a good understanding of research methods, and that this was not was something that we needed to build into the curriculum for it to be more effective. So we introduced a session on research methods primer, basically just talking about the different types of research methodologies and the kind of evidence they produce. We also, out of the field test, try to contextualize a bit some of the theory that we had discussed, particularly in module 1, which is focusing on understanding the policy-making process. We were highlighting some theories there that have been used elsewhere, and participants were very clear for us to, they actually contributed ways of how we can look at it differently to bring in more of the local context. We realized our session evaluation tool was missing out some important information, and so we revised that. And we also revised the timing allocations for the different sessions. So that is how we got some useful inputs from the field test. Now, following the training workshops in Kenya and Malawi that we conducted last year, we drew lots of lessons which we have been using to revise. But some key of these have been the revising the pre and post test tool. So I think we've revisited this quite a number of times following the training, just to see whether they link up well with the training objectives and whether they really measure what is being covered within the training. So we've revised that quite a bit. We introduced some new content, particularly on appraising quality of non-scientific documents. And again, this came out of the trainings, particularly the staff were training from Parliament, and even those within the Ministry of Health, just saying that they use other types of evidence. It's not just scientific evidence alone. And so what are some of the critical, the criteria they should be using to assess documents that are not scientific, which have a methodology and stuff like that. So we introduced some criteria on assessing non-scientific documents. We also critically reviewed and revised some of the learning objectives. Again, going back to the content and what we're learning out of the training and tweaking a bit more of the learning objectives. So again, just note that these are not very comprehensive, but we've tried to pick some of the key things that have been evolving over time with this curriculum. So now getting into some of the lessons and some of the experiences with using this curriculum to do actual trainings in the two countries and some of the lessons. One of them is that obviously expectedly not all learners read the pre-reading materials that we shared. So we shared these, ideally we had hoped to share these 2 weeks prior to the training, but in practical terms we shared this exactly a week to the training. And while some of the learners, engaged with the reading materials, a lot of these are just defining concepts and also providing some reading on research methods, since this was identified earlier as a gap. And so while some learners engaged with this, some of them did not engage with this. And so just thinking about, if you want to use this curriculum, you might want to find ways of gauging who read those documents, who didn't, and how do you encourage those who didn't read to review them even as the training starts, because some of them provide quite useful information that makes the training more effective. Another thing was, of course, just realizing that the curriculum is quite comprehensive, covering a number of different things, but that it can be quite overwhelming to cover in 4.5 days. And I think one of the big comments we kept getting from participants in both countries, in Kenya and Malawi, was that the time allocated was just not adequate enough to cover everything that is within the curriculum. And so, and also to note that even although we are talking about 4.5 days, we had residential workshops, which provided more time in the evenings for groups to have their discussions, have assignments, daily readings. So the 4.5 days may not be a very good reflection, given that we did residential workshops, in which case participants had more time in the evenings to do their group work, their assignments, and daily readings. The adult learning focus of this curriculum meant that learners were very actively engaged, and often this resulted in extensive discussions, which were very good and very useful, but consuming a lot of time, and so resulting in a lot of delays. And so important for people who want to use this to gauge or to have a good way of knowing, how to manage the discussions and the time, because it's a very important aspect of adult learning. You're getting people from the ministry, from parliament, who have been doing this work for a long time, and so they have a lot of experience they're bringing to the training. So it's core learning, but then how does that impact the timelines for each session? Another important thing we thought we should highlight is the flexibility with time, particularly as per learners' requests. So we were really keen to every day to understand how learners, want us to spend the time. And sometimes, even though we said we're starting at 8 and ending at 4, sometimes learners wanted to start earlier and end earlier. So sometimes start at 7:30 and end at 3:30. But again, we're just building in the flexibility just so that we're not stuck on what is on our agenda. We noted also that, as I said earlier, we have evaluation forms for each session. And we realized that computing this real time is really important, because it really changes. It enables you to know whether people are learning anything in the previous session and how do you change strategy. And I have to note, actually, in one of the workshops, that this was very useful, that we had to revisit a session, because when we looked at the evaluation results, realized that a lot of the learners had a lot of gaps, because it had been a bit rushed because the other session had taken so much time. And so we had to revisit it. So again, just being flexible, but also looking at what is coming out of the evaluation session, the forms that learners are filling real time, that this improves the next session that we are covering. Another important point to point out, as I said earlier, this curriculum is very much for health sector technocrats. But again, we've used it in parliaments with people who are working with the education committee or committees focused on other things other than health. And so if someone is keen to use this in a different context, so thinking more about Parliament does not necessarily develop policy, but they review policies. So they have more policy analysts. And how do you refine this curriculum to speak more to their needs? Just note that we're actually going forward to do that and to really develop a more specific curriculum that speaks more to Parliament needs, drawing from what we have here, which is very much focused on the health sector. So something to bear in mind. Another important thing was the selection of learners is really critical. How do you attract learners who are genuinely interested? We tried competitive as application, which worked in some workshops, it didn't work in others. But also understanding learners' incentives for learning. Certificates we realize are not enough. So how do you identify learners who are very incentivized on their own to go through this training? That is something that we are still drawing lessons from, because we had a good number of them, very good people, very committed, but a few of them just not seemingly very committed. So how do you pick that and drop those who are not committed out, particularly for the follow-up program, which was very time intensive. Also important for trainers to be effectively trained, particularly adult learning principles. We realized that the training we had done earlier for the trainers on adult learning principles was really useful in terms of making the training more effective. Another important experience there is that many learners expected the curriculum to teach them on how to develop actual public policies. This came out actually in all the workshops. When we did a session on expectation at the start of the workshop, a number of them said, I need to know how to develop a public policy. And yet our training was focusing on using evidence within this process. So again, just something to flag, but also maybe an area of gap that may need other curriculum in the future. Another lesson is that the pretest, this is more of experience rather than a lesson. The pre-post test results have shown notable perceived changes in knowledge and skills and attitudes. And so kind of really showing us that this kind of curriculum and the kind of follow-up support we provided has been quite effective in building skills for evidence use. The training curriculum has been delivered within the context of a very strong partnership with the governments of Kenya and Malawi. And so if you're using this curriculum in a different context where you don't have a lot of buy-in by the institutions and the leadership, it might give you different outcomes, just something to bear in mind. And finally, I think we're very keen to learn experiences if people get to use this curriculum in a different context without that kind of buy-in at the top level to see how this works out. We also think that the curriculum could be offered, the different modules could be offered independent of each other. What we did was to offer all of them in 5 days, but this could be offered independently. You could build in short workshops where you do a module over 2 days 1 to 2 days covering different modules, that this could work. So it's something that people interested could try out. In terms of looking at some of the strengths and weaknesses of this curriculum, I think on looking at the strength, it's tested, it's proven, given the feedback we've been receiving, the quality of policy briefs produced. We think it's a very comprehensive curriculum. It's underpinned by adult learning principles, which is good. It's also adaptable to different contexts. So we've put in some documents, even in Word, to enable you to revise and use it and change it as appropriate as possible. It's off the shelf. It's something that is ready to use. Thinking about the weaknesses, I think, as I said earlier, it was quite overwhelming, providing this, conducting this training over 5 days. Participants felt the time was not enough. So something to bear in mind. There's also too much emphasis on research at the expense of other types of evidence. So again, as I said earlier, participants kept saying we don't just use research, we use data from health facilities. So how do we assess that? Something to think about, particularly in the health sector where use of routine data is really common. So this particular curriculum does not cover anything on routine data. But we'd also like to really get your views on what you think are some of the strengths and weaknesses of this curriculum, because we think it will continue to evolve. In terms of what next, I'm just kind of getting to the end, so we get into the discussions shortly. We think you can adapt, and also give us feedback on the curriculum. Do feel free to share some of the other tools and resources that you are using with us, particularly on this chat platform. I see a number of people doing similar training, so please let's continue sharing using the different platforms available. We're also at a point where we're exploring how we get this curriculum into universities, particularly medical schools and schools of public health. This process moved quite a bit in Malawi, where the College of Medicine is now using this particular curriculum to develop their own modules on evidence-informed policymaking training to incorporate into their graduate schools training programs. We're also engaging with the government schools of administration. For instance, the Kenya School of Government, engaging them to see how this curriculum gets into their programs, because they provide sustained, continuous training for civil servants. So this is basically sustainability, and we'll be open to other ideas that you may have in terms of getting this into a more sustained kind of training programs, rather than conducting this on and off trainings. And we are very keen to get some of your takeaways from these webinars. We get into the discussion. So beyond asking questions, do feel free to share with us some of the takeaways on how useful or unuseful this kind of curriculum is. And before I get us into the discussion, I would like to just acknowledge the partners, particularly DFID, who has funded the Secure Health Program that has produced the curriculum. Also the governments of Kenya and Malawi, the ministries of health specifically, and parliament, who have collaborated with us in this work, and other secure health partners, the College of Medicine, FHI, Consortium for National Health Research, and the EXA Health Community. So at this point, I would like us to focus a bit more now on some of the questions. If you have any questions, any comments, I'm going to now be going through the chat and picking out things that we haven't talked about, so that we can get into a bit more of discussion on that. And just to note that, as I said earlier, I think before we, during the wrap-up, we'll have some short poll just to get some feedback from you on this. So getting back to, so now getting into the discussions and question and answer, and I think I would like to start with the question on how we tested the curriculum. I think this has already been answered quite a bit in the chat platform, but we conducted a full 5-day training workshop with 5 policymakers, mid-level policymakers within the Ministry of Health in Kenya. And out of this workshop, we actually had very specific things we wanted to pick. We had already outlined specific things we wanted to pick out of the field test. What do we want to learn, particularly on the time for the sessions, but also the content. Is it speaking to the needs? Is it able to be changed in some places? And eventually we did make some revisions before getting into the proper trainings. The other question that Vanessa had raised was how to incorporate politics within these kinds of trainings so that they can complement the very strong focus on technical skills. And again, just to note that we, as you can see, the curriculum is very much focused on technical skills, building the skills to find evidence, to establish and maintain relationships with researchers. And so, and yet we know very well that politics is such a big input, particularly in decision making. Evidence has to compete with politics, interest, values for it to really inform policy. And so just note that we did discuss the politics quite a bit in Module 1, the module that focused on the foundation of policy making, and just kind of getting participants to talk about their real life, policy making experiences and the role of politics into that. And this generated a lot of very useful discussions for us, and even just for learning. So participants just talking about how, in some cases, they have put evidence on the table, but because of political interest, because of values, because of beliefs, that evidence did not play a big role. So we did focus quite a bit of the session on policy making, the foundation of policy making, on discussing the politics, but also other factors that evidence has to compete with. But obviously, it's something that we could share a bit more. And Vanessa, perhaps you can comment a bit more in the chat platform on what you have done in Latin America to get the politics into this kind of training. Also, just note that Kirsten, do feel free to come in and respond to some of the questions on the audio. Don't feel constrained. I was just running through the chat and getting the questions.
Okay, I can jump in. I'm looking at it.
Oh, Sarah, Kirsten, please go on. Sorry.
Okay. And yes, Rose, please jump in on this too, since you are a part of more training than I was. They're first exhausting to deliver to trainers as trainers over 5 days, and I would say the answer is yes. For some of the reasons that Rose mentioned, we were doing a lot of debriefing in the evening and adjusting as needed. But in general, I can say it is an enormous amount of information and material, and in some cases we really were only able to do sort of the basics and a cursory. You could have a 5-day workshop alone on communication strategies, but we were condensing a lot of material. So in trying to hit all of our marks and address what the needs assessment showed, and then over time what different participant groups were asking for, there was really a lot of evolving content, and I think that sort of contributed to the need. And we do say this in our sort of preliminary text for the course. We do suggest that that you use experienced trainers, and really ideally trainers who have some experience with political decision making, and certainly the realms of research, evidence, and looking at how to appraise that, what makes for strong evidence. So that answers, I think, the first question. Of course, though, everyone did a great job and really professional trainers, so it was tiring, but I think we did it. Your second question, did you consider using some theory on knowledge utilization? We did, and I would have to sort of dig a bit deeper into which section. I believe that was in our synthesis module. So you could probably dig in there and see what we touched on, but we really were pulling very broadly. I think one reflection that I can add is that when we first started this project out in 2013 and began looking for a curricula like this to see what exists out there, is there something like what we need already in use? And it was really challenging, and in fact we really didn't find something that addressed our needs already put together. So we were pulling from our partners, of course, from the internet, from other curricula that had to do with measurement and data use and decision making. So it was very vast in terms of our resources and different sources for the content. So I'm going to turn it back to you, Rose, in case you're addressing something else.
Yeah, just to also comment on the question by Sarah on the trainer's qualification or the kind of qualification that trainers need. Yeah, just to flag that we actually on the website where this curriculum is, we have a document that defines the qualifications of the trainers, and it's really critical for effective training to happen. And generally, we are looking at people who have worked a lot in the health sector, and so they understand the health sector issues very well. A lot of our trainers were coming from a research background, so people who have worked in research institutions, people who do knowledge translation or communication of evidence, and the different modules attracted different trainers. For instance, the module on appraising evidence is, we realized was very critical for this to be delivered by someone who's been doing research for a long time. So someone who has a very good understanding of research methods, the kind of evidence they generate, and what that evidence means for decision making. So that is an area where I think if people who are interested in going into this kind of training need to pay a lot of attention to, because the trainer obviously kind of determines the effectiveness of this. And again, the different modules will need different people. Like the module on politics, on foundation of policy making, needed very much somebody who's done policy analysis or political science, and someone who has a very good understanding of the politics of decision making and the role of evidence in all that. So again, just noting that different modules again will need different skills, and varying that. Like the module on applying evidence, which had a large component on developing communication strategies for the evidence once you have your policy brief, again drew a lot from expertise from people who have been doing communication of science over a long period of time. So just that variation is very important. Sarah, you also asked about the whether we incorporate. Let's note that we actually incorporated theory only in the module 1, the module on the policy making process, and we actually just highlighted one theory, which is John Kingdon's 3 streams theory, that talks about having solutions, having the evidence, and having problems flowing as parallel, and then merging those 3 streams, merging at a particular time. Before the field test, I think we had a bit more theory in this, but following the field test, a lot of the learners felt that the theory was, we shouldn't have too much theory in the content, as it does take away the practicality of the training. And so eventually we just refined it. But I think looking at theories of knowledge utilization or diffusion is something that we could look forward to in the future as we look more into this curriculum. Sarah, yeah, thank you. We note that you are about to leave. Let me just run through to see what else we haven't answered. I'm trying to get Maria's question. Yeah, so Maria, you're asking about, one of your questions is whether we used the National School of Civil Servants help us identify the right trainees. No, we did not engage any national school of any public school for civil servants. But what we did was to work with the ministry. So we put up an advert within the ministries and within Parliament, defining the kind of candidates we are looking for this kind of training. Obviously, talking about the training, but also providing a criteria on the level. I think the big thing was the kind of work that someone does. So if we are looking for people who actually develop policy documents, people who develop evidence briefs for decision makers at the high level. And so that was a very important criteria, that for someone to apply for this, they had to be doing those tasks. We also put qualifications at education level. So just saying that someone must have at least an undergraduate degree, first a Bachelor of Arts or Bachelor of Science degree to qualify for the training. I can't share the criteria we had, but we had a very clear criteria to select the right people for this training. But I have to note, however, that in reality, we were looking for about 30 people, for instance, from the Ministry of Health, and about 10 people from Parliament. And while we got a good number of applications from Parliament, the Ministry of Health, we didn't get 30 applications in both countries. And so we actually had to now work with heads of departments to identify their staff who provide them with evidence who would be interested in coming to the training. So we had to change the strategy quite a bit when we realized that we hadn't gotten the right numbers that we wanted for the training workshops that we had planned. So again, learning on, as it happened and seeing how you can change strategy to ensure that you get the right people for that. Your other question is on the mix and match usage of the curriculum. So again, the training was based very much. The training, I have to say, I'm just trying to get a sense of, understand very well your second question, Maria. The training was based very much on building capacities for different types of evidences. So we did not define the evidences for this, but what we did was to work with the learners, throughout the 5 modules. So in the first module, we covered them understanding the policy context, but also them redefining their policy questions to be very specific. And depending on the policy question that someone identified, we then moved to the accessing session in which they build skills on finding evidence, and they went ahead to search and find their own evidences, to respond to the policy questions. So the evidences that were being used during the training by different learners was the evidence that they were finding that speaks to their own policy questions. So we did not come away ourselves with any evidence and say you use this evidence for your questions, because again, as you said earlier, the learners came with their own issues which are relevant to their work or relevant to the work of their units. And so we built very much the evidence, we built very much on them using the evidence that they find following the training on searching for the evidence, the right databases to speak to their policy questions. Abiba, I think I'm just realizing that I have 4 minutes to wrap up. So let me see if I can respond to Abiba's question before we get quickly into the wrap up, as we're running out of time. So Abiba, you're asking about for me to talk a bit more on what makes this more than a one-off workshop. I think, as I said earlier, we realized that one-off workshops would not work, and so that's why we built in the first 5-day workshop, which was residential. But then following that, we did a 1-year follow-up. During the 1-year follow-up, what we did was to contact each learner individual level through email, through phone, through visitations once every 2 months. And then during this survey for once every 2 months, identify areas where learners need more training, and then do 1-day refresher workshops for these learners every 3 months. And some of the areas that drew a lot of interest in the refresher trainings was the issue of appraising evidence. We actually did 2 workshops on appraising evidence. Learners said they needed to learn to get a good sense of how they appraise the quality of evidence. Also, the issue of policy briefs, we did another 2 refresher workshops on policy briefs, just to kind of support learners in finalizing and revising their own policy briefs. So the follow-up workshop was based on one-on-one engagement every 2 months, and then a 1-day refresher workshop every 3 months. I think I'll get into the wrap-up, and we can continue the discussion over email or within this platform, as I realize I have just 2 minutes. But just to note that moving forward, I think we think the curriculum has some level of proof of concept. It's something that could be used given the feedback we have received. But we've also highlighted some important contextual issues that if one wants to use this curriculum, they need to bear in mind. And so we're also very keen to continue getting lessons, if someone uses this, getting lessons on how this works in different contexts and how we can continue making the curriculum work better, because we don't believe that this is set in stone. We think this is something that should continue evolving given where it's being used. Just to draw your attention in the last minute to the poll, which is on the platform. It has just about 4 to 5 simple questions, which we'd like to request you to fill out, so that we get some feedback on how to improve our webinars in future as AFIDEP, but also some feedback on some of the things that we'd like to share. But also to thank you very much for spending this hour with us. And yeah, Leonard, you did ask about providing the training online. Just note that we have the curriculum online, but we are not able to offer the training online because you have to develop to have a platform where someone can take this training online from wherever they are. But that's an area we're interested to go, and it's something that we can discuss a bit more outside this platform. So we'll follow up with you, Leonard. Thank you very much. So I don't know if you can see the poll. So that you can give us some quick feedback as we wrap up. Just to say thank you very much. We really appreciate the interest and all of you staying on this platform for the last 1 hour. And please, let's continue engaging on email about this learning. And we also look at, a lot of you shared some resources which we look at to see how to make training as a more effective tool for enabling increased use of evidence in the future. So I would like to leave it here. Kirsten, I don't know if you have anything to say as we close this webinar. I'll just...
I just would like to say thanks for your comment. I look forward to actually looking at them more in depth and seeing what we can do. And I really like this comment here at the end from Vanessa about a way to keep the conversation going. And I think that with AFIDEP, we'll look at how we might be able to do that. But there are also, and I think there was a slide in there, there are also a couple of networks and listservs that do exchange this kind of information. So we might go back and look there and see how we can keep it going. Thanks, everyone.
For the poll, just remember to click send votes at the end of the 4 questions for this to come through. If you don't click send votes, I think your feedback will not come through. Thank you very much. So thank you very much. I can see quite a number of you filling in the poll, and thank you so much for the feedback that you are providing. I see a number of you still have questions which we will follow up. I think we have your contacts from the platform on email, but also we'll see how else to continue this discussion. A number, I think Maria, you have a question on how to connect with you on social media. Abiba, you have a question on how we have documented online, I think, materials or learning from this kind of training. So that is something that we can continue sharing with you on the different platforms available, but also on email, which we already have your email addresses. So we'll definitely be getting back to the different questions that haven't been answered, but we'll also put the recording of this webinar up for those who are not able to attend. So if you know people who are keen to join us, but they did not join us, please feel free to let them know that they can get the video later. So I'm going to go off on the mic, but to just say thank you very much, everyone, and we look forward to continuing to engage. I can see Maria is sharing his email. It would be good for others to share their emails as well, although I think this maybe were captured on the platform when you are registering, and we will harvest them from there. Thank you very much, and have a lovely morning or a lovely afternoon, depending on where you are on the globe. Thank you. Bye.